I am Dr Hirennappa B Udnur, specialist in pulmonology and sleep medicine and critical care, and I practice at Inspire Specialty Clinic, Sakar Nagar, Bangalore. We know lung cancer, but once you confirm the diagnosis, we don't know the causes. There are risk factors, like smoking is the biggest risk factor that might be a cause, and genetic history and environmental exposure. And we really don't know pinpoint what exactly is the cause. Sometimes they say exposure to asbestosis is a risk factor for a lung cancer. So people who are exposed to asbestos, even a trivial amount of exposure, that's the risk factor. Okay, we normally don't know what exactly is the cause, but once you diagnose the cancer, and we need to treat that now. So the other causes for the scar-like looking like lesions are some non-malignant lesions are there. If there is a old pneumonia, old tuberculosis, it looks like that. Normally when you look at a history and compare it, we don't do any biopsy for it, but sometimes after doing we suspect lung cancer and do a biopsy, we get it as tuberculosis, we treat it accordingly with the tubercular medication. We get it as fungal, and if they have risk factors like post immunosuppressed host or anything is there, if it is a fungal infection, we treat with antifungals. Okay, that's the treatment depends on what is the diagnosis based on the biopsy, and how do you manage it, and based on the diagnosis. So we are looking at a lung cancer too, and there are different stages of lung cancer. Once you confirm the diagnosis, the different modality treatments are there. It's usually the multimodality treatment. So then we diagnose it and we stage it, whether it's an early stage or it's a late stage. So based on the stages, it can be surgery, chemotherapy or radiotherapy. If it is very early stage and there is no spread of the disease anywhere, that we can assess by a biochemical testing, or we do PET scan and there is no mediastinal nodes involved, and there is no metastasis anywhere in the liver, abdomen, bones, everywhere. We have tools for it, and once it is very small, then we go for a surgical resection which has a curative potential, means you have a complete cure for lung cancer. So you may not require chemotherapy or radiotherapy later. So if the size criteria is very large, sometimes mediastinum is involved, so they do a mediastinoscopy or assess if there is already spread to the mediastinum. Based on the stage goes up, as the stage goes up, the prognosis will become weaker. Okay, means the survival chances become lesser and lesser. So based on in stage 2 up to stage 1, stage 2 it is surgery. So more than stage 2, stage 3, based on the performance score, means if the patient is young and he doesn't have any comorbidities and he is mobile, ambulatory, he can tolerate the chemotherapy based on his performance states, then we offer them chemotherapy drugs. And there are new modalities like targeted therapy or a biological therapy, and if the biopsy is done, they do a immunohistochemistry, and these drugs have wonderful results. 3 to 4 years survival chances is there. And so lung cancer treatment, more of this immunotherapy and other things are coming up into picture. It can change the prognosis and the treatment modalities, so it will be treated like a disease like diabetes and hypertension. So if it is really advanced, and if mediastinum, we offer radiotherapy. If it is not amenable for surgery, radiotherapy centers are there, they give in the sessions, and there are side effects for radiotherapy and side effects of chemotherapies are there. That's how we manage. So we will be able to, if you are not able to cure and treat it, and it's usually palliative and end of life care, we advise. So usually when the patient comes walking, it's usually in a stage 2, stage 3, and we assess them properly and treat it.